Good afternoon, Dr. Andy Kirshner here, and welcome back to Backwards. I want to thank everybody for the comments on our pregnancy post the other day. I love it when I put up a post that generates a little bit of conversation, keeps things interesting. I'm going to be referring to my notes today because I do want to address a couple of those comments, and I want to make sure I don't miss anything. Now, in part 2 of the pregnancy thing, we're going to talk about a few of the things that you can do to help relieve some of that back pain before we get to part 3, where I will be doing the hands-on techniques. Now, there's a few things you want to do. First of all, there's some really good exercises out there, some gentle stretching. I do recommend actually prenatal yoga is a great thing, and almost everyone has a local class that they can take. Prenatal yoga is a great way to relieve the back pain associated with pregnancy. My wife got terrific relief from it. Next recommendation, supportive shoes with good arch support. One of the things that I mentioned was the hormonal release of relaxin that happens during pregnancy, and that actually will help the arches to fall during pregnancy, which is why a lot of pregnant women get foot pain. So I recommend supportive shoes, something with a good arch support, something with a little bit of cushioning, and if you can get away with it, sneakers are great. Here's a good one that everybody forgets about, and you want to catch up with this now before you give birth. Regular sleep. Regular sleep is a key thing, especially because once that baby's born, your sleep is going to be gone, at least for a while. I recommend regular sleep, supportive bed, sleeping on your left side, and preferably with a pillow between your knees to offer your hips a little bit of support, and that will go a long way towards preventing the back pain. And the last one, if you do have the funds available to do this, prenatal massage is a great way to help get some relief. You combine these few things and you will get some relief from your back pain. Now, I got a question from one viewer, Stacy, who said, I had no back pain during my first pregnancy 3 years ago, and I have terrible back pain and sciatica now with my second. Why is that? Well, the truth is every pregnancy is different. Things that you have to consider is you're 3 years older now, and it doesn't seem like a whole lot, but as you age, things do change. Your physical condition before the pregnancy and your activity levels before and during the pregnancy can all have a big role on how the back pain affects you or whether you have back pain at all. The other thing to keep in mind is that there are some differences in back pain based upon the positioning of the placenta and the positioning of the fetus. Let's see what we got here. Jen and Heather both talked about having some back pain during their pregnancy, but related that now that they're carrying around their baby and all the associated equipment that goes with that, they're having back pain after giving birth, and they want to know what they can do about that. Look for a post on that sometime next week. Again, I thank you so much for all your questions and comments. They really do keep things exciting. Thanks for visiting the blog, and I look forward to hearing from you soon. Look for part 3 later this week. Be well.